The pill. You know, the pill. Just two unremarkable words. But 60 years ago, it changed the world in a remarkable way, supporting women to have children by choice, not chance. It helped us pursue our own ambitions and take on the world. It empowered us to reach for new heights, support the children we have, and strive for lives free from hardship, to shape our own futures and to shape others, and to live our lives our way. 60 years ago, a world of opportunity started with the pill. Since then, Bayer has been bringing women benefits in contraception and beyond, and continued to innovate decade after decade. All that started with just one little pill. Celebrating 60 years of empowering women. Bayer, your partner in women's health.
Alright, magandang umaga po sa inyo lahat. I am Doc Zed Gallito, and with me this morning is a professor of FEU. She is also a consultant of JRRMMC and BOT of POGS, Sangkapa. Okay? With us is Dr. Ignacio-Alensuela. Ma'am Iggy, good morning.
Good morning, Zed. Good morning.
Okay, so we have a lot of topics to discuss this morning. First question, dire-diretso na po tayo.
Okay, ang dali-dali. Okay,
Okay.
go.
Ang topic natin po kasi ay mga COCs or OCPs. Unang tanong, ano yung mga components ng pills na lagi nating binibigay sa mga patients natin?
Now, the pill is something that is more commonly used by the Filipinas because mas gusto nila kasi nag-demonstrate sila. And the two components that are important would be the estrogen and the progesterone component of the pill.
Okay. Isa-isahin natin. Let's
Okay.
talk first about estrogen, the estrogen component. Does the dose matter? Is it safe to give? Kasi ang dami na nating ang dami ng evidence from previous studies na very hesitant pa rin ang iba sa mga OBs to use specific types of pills containing estrogen. Can you talk more about estrogen, ma'am, and how safe it is?
So, when it comes to estrogen, what we want is something that's low dose. In fact, what we want is something that is ultra low dose. Ang problem kasi when we have hormones, they have side effects. We added estrogen to the combined oral contraceptive pills because the side effect of progestin-only contraceptives would be in irregular bleeding. So dahil gusto ng Pilipina, most Asians want regular bleeding, we added estrogen. But when we added estrogen, comes the side effect of thrombosis. Teka Zed, ano bang dose ng estrogen ang inabot mo?
Nasa 30-35 naman na, ma'am. Wala na high dose estrogen na inabot.
Ako, umabot pa ako dun sa mga times when there was 50 micrograms of ethinyl estradiol. So yun yung tinatawag nating high dose ethinyl estradiol, and we don't have that anymore.
Good.
We only use that for abnormal uterine bleeding. So right now, the doses that we have is 30, 35 hanggang 20. And studies are showing na mas maganda daw. Of course, if we are going to compare the risk for venous thromboembolism, at saka sa arterial thromboembolism, it seems na mas maganda yung 20 micrograms. Although the evidence is not very strong, but it is just logical for us to be on the safer side. So pag ako, magpe-prescribe ako ng oral contraceptive pills and the woman wants an estrogen, then I will give the 20 micrograms.
May question ako, Ma'am Iggy.
Okay.
So pag binabaan natin yung dose ng estrogen, will it compromise the contraceptive property of the pill?
It will not compromise the contraceptive property of the pill because the contraceptive component of the pill is the progesterone, not the estrogen. However, we will have problems with bleeding. If we are going to compare the incidence of abnormal uterine bleeding or breakthrough bleeding sa 20 at saka sa 30, mas madami ang breakthrough bleeding sa 20. Although hindi daw statistically significant. What's important is we educate our patients and we tell our patients, oops, meron yan na irregular bleeding, 30% lang naman. Tapos after 3 months, mawawala na yon. So pag na-orient mo, okay na yun.
Okay. I have another question. Di ba we follow the medical eligibility criteria?
Yes.
When we prescribe pills to our patients, dapat walang mga contraindications or absolute contraindications. If there are some relative contraindications, can we give that lower dose of estrogen-containing pill? Will that increase the safety of the pill?
Yes. Okay. It's nice that you asked about it. Of course, when there are contraindications like hypertension, diabetes, yung mga uncontrolled, and yet the patient, syempre ang choice natin doon, the best would be a copper IUD. Pero kung ayaw ng Filipina yan.
Yes.
Okay. The next best would be a progestin-only contraceptive. Ayaw din ng Pinay kasi nga yung irregular bleeding. So kung gusto ng pasyente talaga na regularly ang kanyang bleeding, then the best choice would be a 20 microgram of ethinyl estradiol.
Okay. So that's a very important point. Marami na tayong options ngayon. Okay? You as an obstetrician should be familiar with all the options, the safety profiles, and most importantly, you should know the profile of your patient.
Yes. Agree.
Okay.
Oo, no, wala siyang one size fits all.
Correct. Hindi pwede magkopyahan dito.
Yes.
So, let's go, Ma'am Iggy, to the second component, the progestin component.
All right.
Why should it matter?
Why should it matter? Because there are different generations of progestins.
Okay, what are these generations and what are the implications of this generation as a component of the combined oral contraceptive?
Parang ano lang yan. Siyempre, biochemistry, tuwang-tuwa ako, di ba? Parang iPad lang yan. Ano ba ang the best? Yung most recent o yung pinakaluma?
The latest.
The latest, syempre. Ganon din ang generations. Now, when we have synthetic progestins, we either classify it based on where it came from or based on the generation. So, doon na lang tayo sa generation. Dati-dati yung first generation progestins, wala na yan sa market. Why? Kasi mahina ang kanyang progesterone activity. So, ang kanyang contraceptive activity is mahina. Tapos, androgenic pa siya. So, inetsapwera na yan. So, ang natitira na lang ngayon would be the second generation, the third generation, and the fourth generation. The second generation is levonorgestrel. The third generation is gestudine, okay? And the fourth generation would be drospirenone and Dayugest. Ano ang pagkakaiba? Lahat sila, the second and the third generation, comes from testosterone. Entonces, androgenic siya.
Correct.
Lesser androgenic lang yung third generation. Pero yung fourth generation, galing naman siya sa drospirenone is not from testosterone. It is a class of its own. It comes from spironolactone. At saka yung Dayugest, talagang galing lang talaga siya.
Spironolactone, diuretic.
Yes, anti-mineralocorticoid activity. So tatandaan natin yan. Dahil doon ngayon mag-fit yung iba-ibang benefits and side effects.
So again, we should know the profile of our patient to maximize the benefits of the pill we will give to that patient. For example, PCOS.
Okay.
What would be the best option for a woman with PCOS?
Best option.
Irregular menstruation is the complaint.
Okay. Abnormal uterine bleeding. Patient with PCOS, what are we going to give? Number one, the estrogen component is already good kasi anti-testosterone na siya. Okay. Now, the second point would be the choice of progestin. It's either you choose an anti-androgenic progestin at dalawa lang yon. Si drospirenone at saka si cyproterone acetate. Kaya lang, if you're going to ask me, stronger ang anti-androgenic property ni cyproterone acetate kesa sa kay drospirenone. Am I going to prescribe cyproterone acetate? Yes, I will prescribe cyproterone acetate. And I can also choose to prescribe drospirenone. Pero syempre, tatanungin mo sa akin, may recent released guidelines, di ba? International guideline on the management of PCOS. And you do remember na ang sabi nila, we have the first line in the treatment of PCOS should not be cyproterone acetate.
Oh, ano daw?
Oo. Kasi daw, okay, we have to, alam mga statisticians yan, nag-aaral ka ng epidemiology, di ba? Ang mga numbers. Kasi you have to look at the recommendation. Ang recommendation is weak for that recommendation. Why? Kasi merong evidences showing that cyproterone acetate may be bad for lipids. That may be. Okay? Maybe, but not strongly. That's why they're suggesting that in the presence of another anti-androgenic progestin, edi unahin mo yung safer anti-androgenic progestin. And that is?
Drospirenone.
Yes.
Okay. Question. When we give our pills, we should watch out for the possible side effects. Most common complaint of patients on the pill, one, breast tenderness.
Okay.
Will a pill containing drospirenone be more beneficial in relation to that side effect? Makakatulong ba yun?
Okay. You have to ask your patient first. Kailan niya nararamdaman yung side effect ng breast tenderness? Is she feeling the breast tenderness when she is taking the pill? Because if she is feeling the breast tenderness when she is taking the pill, give her drospirenone. Why? The breast tenderness is secondary to water. And because drospirenone has that anti-mineralocorticoid activity, in vitro studies are showing that it is good for the breast. Breast-friendly siya eh. It does not contain water at saka pro-apoptosis siya. In other words, the programmed cell death that we have in our breasts are stimulated by drospirenone. Kaya yung cancer formation medyo mahina. Now, again, pagka naman the patient is feeling the breast tenderness when she is not taking the pill, that's another story. Because she is reacting to the absence of the hormones.
And the regimen will matter.
Yes.
Okay, sige. So, punta tayo ngayon, ma'am, sa regimen.
Okay.
Okay. Typical Filipina, Doc, gusto ko nagre-regla ako. Ayoko mabuntis, pero pwede ba yung hindi yung, madalas gusto po ng Pilipina, nagre-regla siya. Meron silang sense na normal. Mali ba una sa lahat, mali ba pag hindi nagre-regla while on the pill yung pasyente?
Okay. Yan ang pinaka-common na misconception ng ating mga pill users. Kasi ang feeling nila, kaya sila hindi nagre-regla kasi naiipon yung pill sa loob, di ba? Tapos bumabalot sa ovary, then the dirty blood is there. As a clinician, as a gynecologist, we all know that it's not true.
Yes.
But we have to take time to explain this to our patients. Kasi pag nakausap si Mare, nako, makikinig sa Marites. Hindi makikinig sa doktor. Yeah, that's why we have to tell them it's not important to have withdrawal bleeding.
Correct.
That's not menses eh. That's withdrawal bleeding during the pill. Diba? Ikaw ba yung mga pasyente mo talagang pinapa-withdrawal bleeding mo ba?
Ako, ang gagawin ko, ma'am, tatanungin ko ano yung preference niya. Kasi we have options and mamaya you will explain further, ma'am. We have options. Options wherein the woman will bleed regularly, so that's cyclic, monthly. Or we also have an option to give it continuously for a prolonged time before allowing her to bleed.
Yes.
Okay. Ma'am, ano ba yung mga regimens natin for giving the pill? And could you also point out the advantages and disadvantages?
Alright. Okay. number one, the acceptability of bleeding monthly is high in the older generation. Kaya, you agree with me
Yes,
that
yes.
younger generation now welcomes no menses.
Correct.
They're more free. There's no bother, right?
Mhm.
And they don't have that heavy bleeding. So, ano ba yung mga regimens? Either you give it monthly duduguin siya, or either you give it at extended days. Pwedeng every 3 months may bibigay, tapos 1 week hindi iinom, doon magbibleed. Or pwedeng all throughout the year. Parang yung all throughout the year, hindi popular dito sa Philippines.
No.
Oo. Pero yung every 3 months, they are accepting it. Especially for our patients with endometriosis. Yeah, di ba? We have been doing that. So, ganun ang mga different regimens. You were asking about the advantage.
Yes.
The first advantage, okay, said, naka-receive ka na ng text sa patient. Doc, nakalimutan ko pong uminom ng pills.
Always.
Nag-sex po kami.
Always.
Oh, diba? Diba? So, yun yung problem. They are actually missing the pill. Hindi siya nagre-rest. There's no such thing as rest. Kaya nga araw-araw iniinom eh. After 1 day, wala na effectivity. That's what we have to tell our patients. Hindi siya naiipon sa katawan. That's why she should not miss the pill. And the gold standard there is do not miss the pill for 7 days.
7 days.
7 days or more.
Okay.
Otherwise, why? There are studies showing na pagka nasa 8th day na ang namimiss, sa 7 days na pill, tinignan nila dati yung follicle size.
Yes.
At nakita nila na pag 7 days nang hindi umiinom ng pills, 16 millimeters na yung follicle.
Okay, malapit na yung pumutok.
Dominant follicle.
Dominant na yun.
Oo, di ilang araw pang hindi uminom. At
Fertile na siya.
Oo. Kaya mas advantageous ngayon na we give the oral contraceptive pill on the first day of withdrawal bleeding.
Okay.
I tell my patients that. So that's the first advantage. Second advantage, walang heavy menstrual bleeding. Walang anemia. We have to tell our patients kasi yung cleansing factor na yan, di ba? Na feel nila yung buo-buo yung dugo. We have to, yung mga older, sabi ko sa'yo, older age group, mahirap kausapin. But the younger ones, okay sila. Welcome sila.
And that emphasizes the importance of counseling.
Yes, oo. And tsaka yung sinabi mo kanina sa breast tenderness.
Yes.
Diba? Sabi ko, you have to ask, when does she feel the symptom? If she's feeling the symptom of breast tenderness when she is not taking the pill, she is reacting to the absence. Of the drug.
Okay.
Yan. So, pagka gano'n ang nakita mo, edi ibigay mo ng mas madalas yung oral contraceptive pill.
Okay.
Kasi hindi lahat ng side effect ay dahil sa pag-inom. May side effect na dahil hindi umiinom.
Speaking of absence of hormones, may nabasa kami, ma'am. PMS.
Okay.
Some patients present with symptoms of depression during specific times of the cycle. How will the pill, okay, help in PMS, in the management of PMS, and what would be the regimen that you would prescribe?
Okay. PMS, para yung endometriosis. Ang endometriosis has been mentioned in the medical books as early in the times of Egypt. Napagkamalan pa na yung mga merong endometriosis-associated pain, naghihysteria daw, may demonic possessions. Ngayon, yung PMS naman, okay, dinededma din. Ano ba? Nag-iinarte ang tawag doon sa teenager. Di ba? Nag-iinarte. Anong mental health yan? But we must be cognizant that PMS is a real thing, especially the younger ones. And there are studies showing na mas maraming young adolescent Filipina ang nag-PMS. And yes, depression is a symptom. What is the cause? It has something to do with the luteal phase, right? With the ovulation, with the luteal phase, and the other hormones. So, anong regimen ang binibigay ngayon? The only accepted oral contraceptive pill in the Philippine market with an indication for PMS is drospirenone. So, drospirenone containing oral contraceptive pills, yan ang bibigyan natin. Why? Because it is the drospirenone.
Okay.
That's taking that effect. Siya lang ang meron nun. The other synthetic progestins will not have that.
So again, it's very important, you ask your patient what the side effects are, if there are other medical conditions, if there are other gynecologic issues that you may address as well. Ma'am Iggy, meron pa ba kayong gustong idagdag?
Meron pa ba? May tatanong ako sa iyo.
Oh, naku.
Okay. Diba? Ikaw naman tatanong. Let's say, for example, we agreed that it's 20 micrograms of ethinyl estradiol that we will give. Most of us have a misconception that we give the 20 micrograms to the older and the younger generation. Any comment on that?
I would look at the profile of the patient more than the age. For me, if there are other conditions that would increase the risks, tataas yung harm, possible harm, I would opt for a lower dose of estrogen contained in the pill.
Like, kunyari, obese yung teenager.
Yes.
Right.
Okay, like hypertension, di ba? Hindi naman porky hypertensive yung patient. Di na natin prescribean. If it's controlled, you want to increase the safety profile or lessen the risks, lessen the harm, I would opt for a 20 containing pill.
Yes, agree with you. I agree with you. Pero yung bang 20 micrograms na ethinyl estradiol for our adolescent will be bad for her bones?
No.
No, di ba?
I don't think
It's
so.
okay, right? So we can still give it to them, right? Yun. So, ang last words ko siguro, just like you, is I'm going to say that the challenge for a gynecologist right now is to be able to choose the right formulation.
Right formulation.
Yes, for the patient. Ang dami-dami pong choices. Actually, among the oral contraceptive pills, among the drugs available in the world, I should say the combined oral contraceptive pill has the longest track of efficacy and safety. It was given in the 1960s hanggang ngayon, 21st century na, nandito pa yan. We have seen drugs na ibinigay, wala pang 10 taon tinanggal na sa market because of the side effects.
Correct.
Despite all of these feared side effects with the combined oral contraceptives like the venous thromboembolism and all the stuff, nandito pa siya. So all pills are safe. That's my first statement.
Okay.
But my second statement is tailor-fit. If we want to choose the safest, syempre, ikaw ba gusto mo mademanda?
Of course not.
Syempre, di ba? Diba? So kung kaya namang ma-afford ng ating patients ang safest pills available in the market, then I guess we have a choice. The 20 micrograms, drospirenone, and also, if we can give it continuously, every 3 months na bleeding na lang, okay na.
Okay. So, I hope you learned something new today. Ang dami po tayo diniscuss ngayon. So, we talked about the components of the pill, safety, possible harm or side effects. We talked about the generations of the progestin. We talked about the different regimen and which option is the most ideal for your patient. So, balikan po ninyo yung pasyente ninyo. So, we want you, after this lecture, we expect you to be more confident when you prescribe the pill to your patients. Okay? So, aralin po natin, that is our assignment. Reviewin po natin yung mga diniscuss natin ngayon para you have that confidence when you go back to your clinic. And me personally, I would always offer the best pill, tailor-fitted to that patient. Okay? But yes, there are some other factors that we need to consider. The costs, a lot of factors. But you will not be wrong if you offer the best option first and then you adjust depending on the other conditions, other financial considerations, okay, other health, medical conditions. So you adjust to that. Okay?
Yes,
so,
well said.
Ma'am Iggy, anything else?
That's all.
Okay, so we would like to thank Ma'am Iggy-Alensuela. That was a very fruitful discussion. I've learned a lot.
Thank you.
And
ang ganda naman ng umaga ko. Ang gwapo-gwapo ng aking kasama.
Ang sarap din malaman na tama pa nga yung ibang mga alam ko. So I hope, you learned something new today. Maraming salamat po sa inyong pakikinig and enjoy the rest of the day. Thank you so much.
Good morning.
Good morning.
Here at Bayer, our efforts to continually innovate and help avert unplanned pregnancies empower women to make informed choices. So what are the concerns of a modern-day Filipina about contraception?
Let's ask Mara. Mara is an artificial intelligence chatbot designed to answer frequently asked questions regarding contraception. Don't worry, Mara is only meant for informational and educational purposes and will never replace actual consultations with a doctor.
Hi everyone, I'm Mara, your go-to gal for contraception. As a chatbot, I've exchanged messages with curious ladies, and here's what I found out. Meet Kathy, the cycle control seeker. Kathy's main concern is that she wants protection, but she's frustrated by her irregular cycle, and at the same time, she's also worried and embarrassed about unpredictable bleeds each month. Is there anything you can do to help her?
Sure, Mara. It's just as simple as ABC.
Yaz is a well-accepted oral contraceptive for cycle control with low discontinuation rates due to irregular bleeding when compared to other COCs.
Over 85% of patients experience no intermenstrual bleeding in between the 2nd to 7th cycle.
With just 20 microgram of ethinyl estradiol, a low-dose COC combined with drospirenone as its progestin component, Yaz is effective and generally well-tolerated with a safety profile comparable to other COCs.
Yaz offers Kathy, a cycle control seeker, a pill that's more than just contraception. It also brings her peace of mind with period regularity.
That is great news! Learning about the added benefits of the right oral contraceptive pill gives me and my girlfriends peace of mind. I will tell them to consult with their OBGYN and find out which pill suits them best.
Just remember, Yaz is as simple as ABC.